In yesterday's preseason NFL game between the Detroit Lions and Atlanta Falcons, Lions safety Norris appeared to get injured after making a tackle on a Atlanta Falcons running back. He appeared to lay motionless on the field for several minutes and was ultimately carted off, resulting in the cancellation of the game after discussion between both coaches. As you can see in the slow time-lapse video here, it appears that Norris's neck snapped back while making a tackle and then snapped forward. This appears pretty classic for whiplash type of injury. However, there are several different mechanisms by which a nerve injury can happen over the course of a football game, and the treatments can vary, as can the severity, pretty dramatically. On one end of the spectrum is what's called apraxia. Apraxia is usually a result of stretch injuries to the nerve. Typically, you see it involving the nerves of the arms, involving the brachial plexus. This results in temporary loss of movement, but almost always the patient recovers fairly quickly, and usually no surgical treatment is required for this. This can be described almost like a stunning of the nerve from the stretch that happens as a result of the injury. Now, in a normal spine, there are ligaments as well as discs that provide protection or a buffer when the neck flexes or extends, especially in a dramatic fashion. This can be seen, for example, in a motor vehicle accident where a patient may have a temporary flexion and extension type of injury where they have some neck pain but can recover completely without any type of injury. However, in cases where the spine is congenitally narrowed, such as in the picture shown in the inset, this can result in potential injury to the spinal cord during this flexion and extension because there's very little buffer that protects the cord itself there. In cases of a congenitally narrowed spine, surgery may or may not be required. If the patient is improving, the decision may be made to wait on surgery to see if they have continued improvement. In other cases where there is a neurologic deficit or severe compression, the decision may be made to proceed with decompression to relieve the pressure on the spinal canal. In the other end of the spectrum are what are called flexion and distraction injuries. This is where both the disc and the ligaments of the spine are injured as a result of an extreme flexion and an extension injury, where there's basically distraction of the posterior elements or the ligaments in the back of the spine. As seen in this picture here, this can oftentimes result in spinal cord injury, and these are generally viewed as highly unstable injuries and require urgent surgery and oftentimes decompression as well. It appears from reports now that Mo Harris does have movement in his extremities as well as some sensation, so we wish him a speedy recovery, and our thoughts and prayers are with him and his family.